Shin splints, medically called medial tibial stress syndrome, are one of the most common overuse injuries in active people. They cause pain along the inner edge of your shin bone, usually in the lower two-thirds of the tibia. This pain often shows up during or after exercise, especially with running, jumping, or sudden increases in training. Here's what's actually happening inside your leg. Shin splints are not just muscle soreness. The current understanding is that they are a bone stress injury. When you repeatedly load the tibia, your body tries to adapt. But if the stress comes too fast or too often, bone breakdown starts to outpace bone repair. This creates a stress reaction in the bone, which leads to that deep, aching pain along the shin. In some cases, surrounding tissues like the fascia may also contribute, but the main issue is the bone being overloaded. So, who gets shin splints? They affect anywhere from 4% to 35% of athletes and are especially common in runners, dancers, and military recruits. Certain risk factors make them more likely. These include being female, having a higher body mass index, flat feet or excessive foot pronation, and a previous history of shin splints. In fact, if you've had them before, your risk is over 6 times higher. Weak hip muscles, tight IT bands, and changes in running mechanics can also increase your risk. Diagnosis is usually straightforward. Doctors don't need fancy imaging most of the time. If you have tenderness along a stretch of your inner shin that's at least a few centimeters long, and the pain matches your activity, that's often enough. Imaging like MRI is mainly used to rule out something more serious, like a stress fracture. Now, let's talk about what actually works. The most important treatment is simple: rest. That doesn't mean doing nothing forever, but it does mean reducing the activity that caused the problem. There is no single magic fix that works better than rest alone. That said, some strategies can help. Shock-absorbing insoles may reduce impact stress, and arch supports can improve foot mechanics. Physical therapy can address muscle imbalances and improve how you move. The good news is that shin splints almost always get better with proper management, but if you ignore them, they can progress into a stress fracture, which is a much more serious injury. So, if your shins are starting to ache, that's your early warning sign. Your body is telling you to slow down before it forces you to stop.